can give even BID or even TID. The diclofenac, however, comes in two different formats. So diclofenac comes in two formats. It can be diclofenac sodium or diclofenac potassium. Diclofenac potassium is for much severe pain. Diclofenac is just for regular pain. And for the diclofenac sodium, which is the most commonly used by the people, it comes in either like 50 or 50 mg or 75 mg. The diclofenac potassium, however, comes in 50 mg. Right, now because the 50 mg you can give 3 times a day, which comes about 3 times, so it will be roughly around like 150 mg per day. So max dose for diclofenac, max dose is 150 mg per day. If you're prescribing somebody 50 mg tablets, don't give like more than 3 times a day. And you can divide this 24-hour shift in like 8 hours. Like after every 8 hours you can give diclofenac, but don't go beyond 150 milligram per day, because after that the risk will start, right? So the GI risk will be if you will use 150 mg per day or more than that. So this was for the GI risk, right? Now let's talk about its onset of action, how fast the diclofenac starts to work. It will start to work in like 30 minutes to about 1 hour time. The peak it will take roughly around like at 1 to 2 hours, and overall duration of action is somewhere about 6 to 8 hours, depending upon the person's metabolism and other stuff. So 6 to 8 hours. So you can give max like 3 dosage, right? 3 doses of diclofenac. Let's quickly see what the diclofenac was. So the diclofenac was a very good analgesic. It has 3 upward arrows. It was a fair antibiotic, not that great, but it was a good anti-inflammatory. However, it was still having a pretty high risk than the other NSAID, right? So we must keep all these stuff in mind, that it is very, very good for musculoskeletal pain and inflammation if there is no fever at all, right? And there was a higher risk to cause a GI bleed. Now talking about the side effects, diclofenac increases your liver enzyme, and giving somebody diclofenac, there will be a incidence of cardiovascular stuffs, right? Patient may experience pounding of heart, they can be even heart attack in some scenarios. So that was about the diclofenac. Now we just said that the diclofenac has again less range in which it can cause GI risk. So we often help diclofenac along with a PPI. And what's the name of PPI for diclofenac? It has to be rabeprazole, which is 20 mg OD. So diclofenac along with rabeprazole or rabeprazole. This is the combination you should prescribe somebody. Again, single dose won't hurt that much, but some patient may experience even in single dose that anxiety can set in after giving diclofenac. So please rule out any kind of heart conditions before giving diclofenac, because heart is that structure which can be lethal, right? So this was about the diclofenac. And for the indication when to give diclofenac, you can give diclofenac in arthritis, you can give it in musculoskeletal pain, inflammation kind of stuff. It is very, very good. Now Talking about the combinations of diclofenac, let's write it over here. Combinations of diclofenac. First is it was lacking the antipyretic effect, right? So you can add with diclofenac plus paracetamol. First one. This is also called as zerodol P, right? Next is the diclofenac. Now, because of some properties, you can add the ceratopeptidase. Next is diclofenac plus misoprostol. Diclofenac plus misoprostol. So all these three combinations are available for the patient. If you want to give diclofenac, try to adjuvate with all these three other drugs.